Hi, everyone. Thank you for joining me today. My name is Laurel Heppner from Heppner Group. Today, we're going to talk about the 4 different parts to Medicare. Medicare Part A, B, C, and D. I'm going to go through each part and simplify them for you so you don't make any mistakes when you're enrolling. Let's start with Parts A and B, also known as Original Medicare. Medicare Part A is the hospital insurance. I always refer to that as the brick and mortar because it covers 4 things. It covers room and board when you're in the hospital, home health care, hospice care, and transitional care. Now, there is no premium for Medicare Part A because you've already funded it through all your FICA taxes, also known as your Medicare taxes. So if you or your spouse have worked 10 years or 40 quarters, then you do not pay a premium for your Medicare Part A. All that money that was coming out of your paycheck all these years, the FICA, again, also known as Medicare taxes, was going to the government. So when you turned 65 or became eligible for Medicare, you would not have to pay a premium. It's important to know that Medicare Part A does not cover long-term care when you're in a nursing home, or it doesn't cover custodial care for home health care. With Medicare Part A, there is a deductible per benefit period, and in 2024, the deductible is $1,632. That will cover you for the first 60 days in the hospital, but if you're in there for an extended period of time, then there is a daily copayment of $408 per day. In order for home health care to be covered, it has to be because it's medically necessary. And Medicare does have criteria that has to be met in order for it to be covered. So they're not going to pay for someone to come over and cook and clean and bathe you. You actually have to be homebound, and it has to be pre-approved. And maybe it's someone to come over to provide physical therapy or occupational therapy or speech therapy or administer medicine, change bandages, those types of things. Transitional care is not the long-term care. Transitional care is short term. It's if maybe you had hip surgery or knee surgery or shoulder surgery, and now you need to go into transitional care for a short period of time to get better. Maybe you're getting physical therapy or occupational therapy or speech therapy, something to get you better so you can go back home to your daily living services. Those are the types of things that will be covered under Medicare Part A for the transitional care. Hospice care is covered at 100% by Original Medicare, but it does not cover the room and board. So if you're in a transitional care facility or in the hospital, it doesn't cover the room and board portion of it. It will cover the medical coverage that you get. So that's all for Medicare Part A. Let's move on to Part B. Medicare Part B is the medical insurance. It covers things like doctors, lab, surgeons, x-rays, ambulance, and a lot of ancillary services. A lot of people are surprised that there is a premium for Medicare Part B. When I started in this industry, the Medicare Part B premium was $17.80 a month. There is a provision in the law that says if a COLA is issued, which is a cost of living adjustment, then the Medicare Part B premium can be increased each year. In 2024, the Medicare Part B premium is $174.70 per person per month. Medicare Part B does have an annual deductible, and in 2024, the deductible is $240. Once you've satisfied your deductible, then Medicare will cover services at 80%. So there are some things that are not covered by Medicare, like routine eye exams, eyewear, routine hearing exams, hearing aids, dental, and some preventative care. So something really important to know is Medicare does not provide an out-of-pocket maximum, which I refer to as your financial safety net. Because Original Medicare has an inpatient deductible and then they cover services at 80%, if you had something catastrophic happen to you and you had to pay those inpatient deductibles and then 20% continuously, there's never a time where Medicare says you've now paid enough out of your pocket and we're going to cover you at 100%. The sky's the limit. You'll just continue to pay that 20%. So Medicare Part C is also known as Medicare Advantage plans. They were developed by Medicare back in 1996, but they are administered by private insurance companies. They include your Medicare Part A and B benefits. Oftentimes, they will add in Part D, which is a prescription drug coverage, And because they're administered by private insurance companies, they will add in all sorts of extra added value benefits like dental, vision, over the counter, hearing, free gym memberships, and so forth. They can run as low as a 0 monthly premium, but you do need to continue to pay your Medicare Part B premium, and you have to continue to be enrolled in Medicare A and B. One of the most important things about a Medicare Advantage plan is they do include the out-of-pocket maximum, which I referred to earlier as your financial safety net. So there is a maximum that you would ever have to pay out of your pocket if you did have some type of catastrophic condition. Medicare Advantage plans are increasing in popularity due to the comprehensive benefits that you receive under those plans. In fact, they have now surpassed Medicare supplement plans in enrollment. So the last piece is Medicare Part D, which is also known as the prescription drug coverage. Now, there was no prescription drug coverage for people on Medicare until June of 2006. That's when CMS or Medicare developed this drug coverage. And when they did that, there were 40 million people enrolled in Medicare, and Medicare just didn't have the staff to enroll that many people into a Part D drug plan all at the same time. So they contracted with the private insurance companies to do so. So Medicare Part D is owned by the government, but administered by the insurance companies. Now, Medicare regulates it, so they tell the insurance companies to a certain extent what these drug plans are going to look like, walk like, and talk like. But they also gave the insurance companies flexibility to develop their own drug plan. Now, Medicare came up with a standard level of coverage and told the insurance companies, don't ever offer less than this for a Part D drug plan, but if you want to offer more, go ahead and do it. So the insurance companies got real creative. Now, we have a lot of different Part D drug plans to choose from. Each insurance company has their own premiums, their own co-pays, their own pharmacy networks, and most importantly, each insurance company has developed their own formulary, which is the list of covered drugs. So this is where it's really critical when we sit down with clients to make sure that they get enrolled in the right drug plan that, number one, covers the drugs that they take, that they can go to the pharmacies that they want to go to, and they will pay the least out of pocket. So again, Part D is a Medicare benefit, but it's administered by the insurance companies. So even though Medicare owns Part D, when you enroll in a Part D plan, you do it through a private insurance company. Part D drug plans vary in premiums. They can range as low as 0 premium on up. It just depends on the benefits under the plan. Thank you for sticking around to the end of the video. I hope you learned some valuable information. And if you have any questions, give us a call. We'd be happy to help.